Welcome back, everyone, and thank you for joining me for our Visionary Insight by Angie Kalousek, Ebrahimi, Executive Director of Mind Body Sleep Body Medicine at Blue Shield of California. She will be presenting some of what BSC has been seeing in terms of how its member population has really adapted to COVID-19, as well as BSC's strategy for really addressing the needs of their members during this time. Angie?
Thanks so much, Kristen, and thanks so much for having me today. It's a pleasure to be here at Connected Health Summit. And so today, as Kristen said, I'm going to be talking about a subject that is near and dear to all of our hearts, and that's COVID-19 and how it has affected healthcare. A lot of things have changed. Some things have stayed the same, but overall, it has really allowed us to move forward with some of the necessary healthcare evolutions within healthcare. So I'm very excited to talk about these topics. So let's just level set a little bit about our situation right now in healthcare. When we created this deck a couple weeks ago, we had 5.5 million COVID cases, 170,000 deaths. I think now we're up to a little over 6 million, 185,000 deaths, or pretty close to that. So we know that COVID-19 is something that is obviously very, very serious. We also know that it's here to stay for the foreseeable future. We know that they're working on a vaccine, they're in phase 3, but it's going to take a while for that vaccine to get spread widely. And until then, we're going to have to live with a different reality. You know, a lot of virtual experiences, sheltering in place, and I know that all of us can relate to that very closely. In parallel to what's going on with COVID-19, we also, and this has happened even pre-pandemic, we have a problem in healthcare, and that is that we have a population that is like 80% of the population has preventable conditions, and we're spending $526 billion a year on treating these preventable lifestyle diseases. And I think the key word there is preventable, and we'll talk a little bit more about that as we go through the presentation. These conditions are things like obesity, type 2 diabetes, hypertension, hyperlipidemia, and the things that lead to heart disease. And again, as I mentioned, all of these things are things that can be addressed and prevented. And then one very interesting thing that we're learning is that while you may think that a lot of these diseases and disease burden falls on some of the older population, it's been kind of shifting a little bit, and millennials are experiencing double-digit increase in 8 of the top 10 health conditions. So it's not just, old people, quote unquote, that are dealing with these conditions. It's also younger people. And then furthermore, many of these conditions are tied in with behavioral health and mental health, and those conditions and needs are rising very significantly. So that was a lot of gloom and doom, but let's focus on the positive, because there are a lot of positives that are emerging from the pandemic. There are some overdue changes that needed to be made within healthcare, and the pandemic just pushed us along to making some of those changes. So let's talk about telehealth. In the pre-pandemic environment, telehealth was something that was, used sometimes, but not all the time. And now we're finding that a lot of the population is using telehealth. I'm going to be talking today about our digital therapeutics platform called Wellvolution that we introduced to our population in June of 2019. In that platform, pre-pandemic, we saw about 80% of people using digital therapeutics versus in person. So we had about 20% that were still using in person. And now 100% are using digital therapeutics over in person. And you might suspect, and is true, that that's largely because they are unavailable at this point in time. But even sort of regular virtual PCP and healthcare visits through telehealth has skyrocketed. So around 10% of population pre-pandemic, now almost 50% of people are utilizing telehealth in some form or fashion. And what's really interesting about that is that more than 3/4 of them are saying, you know, I think after the pandemic's over, I'll continue to use it because it's convenient and I'm continuing to get the quality care that I got in the past. Another issue with telehealth in the past was that a lot of the providers weren't comfortable with it. So they weren't even offering it. And of course, they now are also forced to make those changes, but now they're also comfortable with it. So it's like we now have a whole new modality of delivering healthcare that is very, very consumer friendly. Blue Shield of California has really been good at propping up this boost in telehealth. One is with this Wellvolution platform that I'm going to be talking about. And the other is because what we did in the beginning of the pandemic is we said, okay, all of our members, all of your co-pays for telehealth are waived. And even if you didn't have telehealth services in your product, you now get it today, right? So kind of making some of those systemic changes to help support telehealth was really important to our members. So let me talk a little bit more about this Wellvolution that I keep mentioning, and what is this thing that we're offering to our members? So simply put, Wellvolution is a platform that is focused on preventing and reversing disease through science. And that science is squarely rooted in our belief and our knowledge that lifestyle medicine is often the most clinically effective, definitely the most cost-effective, definitely the least invasive, and least risky intervention that's out there to treat chronic conditions. And when I say least risky, I mean there are no negative side effects to lifestyle medicine. In fact, only positive side effects exist with lifestyle medicine. We do offer solutions to people across the health spectrum. So we have programs for people that are generally healthy to help support their lifestyle. We have programs for people who are at risk for developing disease. And we also have programs for people who already have some kind of chronic condition. As I mentioned, we did launch Wellvolution in June of 2019. At the 1-year mark, we had a little over 23,000 people enrolled. Now it's up to about 30,000, and we had 10 million member interactions in 2019, which we think was terrific. And you might think, wow, that's a lot of interactions for 23,000 people. And the truth is, these programs that we're offering are very, very high touch programs. So once a member is enrolled and engaged, they might be interacting with their provider several times a day. And that's how we're able to get these 10 million member interactions, which creates that adherence and also helps us deliver clinical outcomes from the programs. So speaking of clinical outcomes, we have seen that the average weight loss for people in these programs is 5%. For those who are in type 2 diabetes reversal programs, 3/4 of those members are normalizing their A1C, which is really significant. We're also seeing that people who are on medications, and most people that have chronic conditions are taking, 7 to 10 medications per day. Post-program, they're down to, in many cases, none. And in some cases, they're taking maybe like a metformin just to sort of support their trajectory, but it's minimal. And that's not only a great cost savings, but it's also wonderful for the member who may or may not have been experiencing side effects from those medications. And we are the largest digital therapeutics network in the US. We have about 55 or 60 digital therapeutic programs that our members can choose from. And I'm going to explain a little bit more too about how people engage in the platform. And I want to set this up a little bit by kind of organizing ways that we think that the design and delivery of healthcare are changing and sort of illustrated through the Wellvolution platform. So that first way is that people want meaningful and personalized health programs. And we took this really seriously as we launched Wellvolution, to the extent that we did a consumer co-design of the whole program. So we recruited some of our members, some non-members, just sort of general people in California. And we said, what is it that you would want in a program that was here to help you achieve optimal well-being, and mostly through lifestyle? And so we got some very, very distinct themes in that consumer co-design session. One of those themes was, guys, one size fits all doesn't work. I'm a unique person. I have unique needs. And so I need a program that is personalized for me. I don't want a program that you're rolling out to your entire membership and thinking that it's going to work for me. So creating programs that are personalized. The second thing that came out was curation. And so while I am unique, I may need a little help from you, the experts, to tell me which programs, given my unique needs, would work for me. So we incorporated that into our platform. And then finally, while I would like you to curate for me, I want to be in control of my own personal health journey. So at the end of the day, I'm going to make the final decisions. And in the Wellvolution platform, the way that we do this is we, once a person enrolls in the platform, we ask a series of just really simple questions. Some of them are kind of health history questions. What's your height, your weight? Do you have a chronic condition? But then we get more into the meaning. Why if weight loss is your goal, why do you want to lose weight? Are you, do you want to play with your grandkids, or do you have an event coming up that you want to get healthy for? So we're starting to kind of get into the motivations. And then in addition to that, we ask, how do you want to engage? Do you want a telephonic program, a digital program, an in-person program? So we really are kind of creating that unique, personalized healthcare delivery system. And then once someone answers all the questions, they get 3 recommendations. Based on the way you answered these questions, here are 3 programs that we have in our network that we think might work really well for you. However, if these 3 don't look good to you, here's a list of all the programs you can choose from. So again, we have the personalization, the curation, and the ultimate control given to the member. I think the next thing, the next way that the delivery system has changed and the consumers are expecting something more is that we need to move our thinking away from transactional healthcare into delivering experiences. And I think we've done this with our Wellvolution platform. We did a study at the beginning of 2020 asking our members what was the most important thing that they wanted to be communicated about. And the number 1 thing was urgent care. So how do I get to an urgent care center? But the number 2 thing was wellness, well-being, lifestyle, basically ways that they can help themselves be healthy. And what was interesting is that only 15% of those people said they were aware of our programs. And so since then, we've done a really big overhaul in the way that we communicate to our members. We've made these programs more front and center in our web treatment, and as well as our monthly newsletter and that type of thing. So we're getting a lot more interest in the program because there's a lot more awareness. We've also found that with these digital therapeutics, we're seeing that people are reducing their costs. So in terms of creating experience, that's the experience that people live every day, right? Is, I'm paying $100 for this medication and $50 for this one. We can reduce that by 30%, if not more, and that's just an average. One other thing we're learning is that about 50% of our members, actually a little bit more than 50%, choose weight loss as their goal, which is not surprising. And even if they have a chronic condition, weight loss may be their goal. And what we're seeing is that 31% of those people are achieving clinical outcomes in weight loss. And that's when you think about how sort of some of these programs work. Some people enroll and drop off. Some people enroll and engage lightly. So for 30% to actually achieve the clinical outcomes is really, really strong. And the overall satisfaction rating is about 94%. I think one of the most powerful things is that we are getting hundreds of member testimonials that are saying, thank you, Blue Shield of California, for changing my life. Literally, not only did I become non-diabetic, I normalized my A1C, but now I don't have pain in my joints. I don't have sleep apnea anymore. I don't have asthma anymore. I have a better sex life. I have more energy. So it's that experience that we're creating, that it's not just a transaction. We are going to help you reduce type 2 diabetes. What we're doing is we're helping you be an optimally healthy person, no matter what condition that you have. And this is really part and parcel to the third thing, which is breaking the siloed approach and doing so in favor of whole person healthcare. And I think we've all been very guilty in the healthcare industry of that sort of siloed, oh, you have a physical problem, oh, you have an emotional problem, or you have a social problem with access to healthcare. All of that is one person, right? So whether you're dealing with a physical condition, there's a very good chance that you're also dealing with emotional stresses, maybe social stresses as well. So for our programs, most of these programs are centered around a physical condition, but even members who are engaging in programs to address their physical health, they have those emotional and mental health needs. And all of our providers, and this really happened somewhere within COVID, they're beginning to incorporate behavioral health management in their physical health programs, knowing that we are treating a whole person. And again, and I said this earlier, but this lifestyle approach, because we're treating the whole person and not just kind of siloing out one element of a person's needs, is the most clinically effective, least invasive, least costly, and produces only positive side effects. So I think I would be remiss if I didn't also address the fact that in this pandemic, there's also a humanitarian crisis that has been amplified. And I think that this is not something that began because of the pandemic. It's something that we're seeing more clearly because of it. But there is definitely an inequity in ability for people to access healthcare. And that's a really, really important thing to figure out and to address for health plans and health providers everywhere. So we know that these social determinants of health exist, and we started to dig in. We also did this with our consumers, and we asked them in this social space, what are the most important things to you? One of those that comes up a lot is transportation, and we do offer transportation services for all of our members that need that to get to doctor's appointments and so on. That has become less front and center in COVID because more people are engaging virtually. But one of the things that we uncovered is that people literally don't have the bandwidth to participate in digital programs because they don't have the data plans that support that. So in our social program that we're launching at the end of this year, we will begin to offer cell phone data assistance to members who don't have adequate data to engage in these digital programs that we're offering. Furthermore, we will be offering food services. So for people who live in a food desert or don't have the ability to get healthy fruits and vegetables, they may be engaging in a weight loss program. They're going to need those healthy fruits and vegetables to support their weight loss effort. So we're providing as part of that program, not a meal delivery, but food delivery service to support that. I also want to call out that this Wellvolution platform is zero cost to the member. So there is no copay, no co-insurance. It is 100% covered by Blue Shield of California. And that's how strongly we believe that these programs are effective. And then finally, we have decided, when COVID began, we said, okay, all copays for telehealth are waived. We have extended our commitment to cover those copays and not to charge them to our members. And that will go on as long as we need to in this crisis. So with that, let me just wrap up with a few of the key takeaways from today. So we know that digital formats are driving healthcare right now. 80% in our platform pre-pandemic, now 100%. But I think even more poignant than that is that telehealth in general went from 10% to almost 50% during the pandemic. I think this whole experimentation with different business models and really treating the whole person, we're getting to a place where we can do that with our providers and our members as payers and work very collaboratively together to create the best possible solution. I think that the future of healthcare is going to be personalized. It's going to be experiential and holistic. And I guess the other thing is just that this Wellvolution platform that we launched in June of 2019, we were very fortunate to have it when COVID hit because we had something to offer our members that was terrific out of a pandemic, and in a pandemic, even more important. And I think that just kind of crystallizing it into one very salient point is that we're successful because we're not just checking a box, we're changing people's lives. So really going back to that, we see you as a whole person, as a whole human being. And with that Wellvolution program, we can address your needs. So with that, I'd love to answer any questions, and thank you for your time and attention.
Thank you, Angie. I think that was a wonderful presentation and very good to learn more about Wellvolution and really what Blue Shield of California has been doing during this crisis. I think we have about 5 minutes or so for questions. I certainly have a few I would like to ask, a few extra points to go over. So I'm very interested in how Wellvolution recruits participants. Do you guys do any kind of targeted marketing in order to recruit your member population? For example, targeting maybe some of the most at-risk members of the population?
Yes, we do. So Wellvolution is available to all members. Actually, I'll say with the exception right now of Medi-Cal or Medicaid. We are launching to the Medi-Cal population at the beginning of 2021, so very soon here. So it will be all members. And so for that, as I mentioned earlier, we have a whole spectrum of programs that no matter where you are in that spectrum, there are programs that could help you, whether it's, hey, I'm training for a marathon, I'm really healthy, but I need an app to track my runs and get healthy, we've got that. You may be someone who is pre-diabetic. I have a family history of diabetes, type 2 diabetes. I'm not diabetic yet, but there are some signs that I'm going in that direction. Let's nip it in the bud. And then we have programs at the very highest acuity, like I'm over 30 BMI, or I have type 2 diabetes, or I have hypertension, hyperlipidemia, and so on. So to answer your question, we do a number of things with marketing. So we have a monthly newsletter that we send that it is segmented, but the segments are pretty broad. In those segments, we try to provide very salient articles about health and also direct links to Wellvolution. So that's kind of the monthly, just informational communication. Mm-hmm. The other thing that we do is we do have a health population tool where we can look at our claims and see who specifically is a type 2 diabetic or falls into that chronic condition bucket. And to those people, we do specific and much more targeted communications. We are highly digital. We do most of our marketing in digital format, but for some of the populations like Medicare, we know that, and Medi-Cal too, really, we know that those folks are less likely to be online and doing in person direct mail pieces for that type of marketing. We also do a lot of social targeting. So we do some social media, and that's, it's member and non-member alike, but we try to steer based on our targeting people into the right programs in those social communications.
Okay. Have you thought about maybe working with some of the physicians and others in your network to actually have them prescribe Wellvolution to their patients?
And so a couple of things. We started with the consumer. We felt like we had a little bit more direct access and maybe even a little more direct influence on the consumer. So that's where we started. But we are, a year in, we said, okay, we've figured this out and we'll continue to fine tune it. But we know that people trust their PCPs and their providers. And how do we get in front of our provider communities to educate them about Wellvolution and to get them, as you say, to prescribe it? So we are we're doing some pilots with our ACO groups where we're doing some trainings of those providers. We're creating some communications for them to give to their patients with distinct URLs so we can track to see if they're working. So we're just beginning that work, but I think that there's a lot of promise in it. The other kind of more provider angle that we're going is in the mental and behavioral health space. We are exploring the use of prescription digital therapeutics. So this is this idea that instead of a pharmaceutical medication, that a provider could prescribe cognitive behavioral therapy or other interventions that could be in the form of digital therapeutics. And so those, we're starting narrow with that, and that would be mostly in like substance abuse, depression, anxiety. So in those kind of specific areas, and then we'll kind of see how that works. A very, very new field. Not a lot of people are doing it. In fact, I don't know if anyone's doing it yet. So we're kind of starting to peel the onion back on that one, but hope to have that in place by 1/1/21.
Some very exciting developments, it sounds like. I think we might have time for one more question, so I'm going to go ahead and ask. On Tuesday, I briefly discussed some of the major challenges that we certainly expect to see over the coming months and years as COVID kind of continues on and more people need to turn to telehealth in order to get care. You spoke earlier to that unconnected population and the need to engage with them. Parks Associates estimates that something along the order of 14 million US households don't have an internet connection, including a fixed connection to the home or even a smartphone. Can you maybe talk a little bit more about how BSC is engaging with this population? How do you identify members who may not have a smartphone or might need assistance to actually get telehealth? And do you have any partners providing connectivity?
Yeah, we do. And so the way that we are approaching that, so I think that the majority of those folks fall in our Medi-Cal lines of business. In some cases, Medicare, or what we call Cal Medi-Connect, which is kind of like a Medicare, Medi-Cal overlap. So yes, so what I spoke about earlier is that within Wellvolution, if you have a need for data subsidy, we can provide that to you through the social program. The step before that, I think, is where you're going with this, in that, like, okay, well, how do people even know about Wellvolution if you're driving most of your communications digitally? And even if they got a communication via direct mail, how would they get access to the program and so on? So one of the ways that we are addressing this, there's two really. One is in our Medi-Cal population, we have a number of community resource centers where the members can go in person And if they have a cell phone but don't have connectivity, the Community Resource Center can help them get connected and get hooked into the programs that we're offering. If they don't have a smartphone or any kind of laptop or computer or anything, they can help them enroll in an in-person program, because they may not ever be able to, engage digitally. And I think that's sort of looking beyond COVID, because we will get back to in-person programs. They always will have to be an option for a portion of the population. So that is one other way. The other way is that we have a number of health educators that work in our Medi-Cal population, and we are offering kind of like a call-in number for members to call in and say, hey, I want to take advantage of these services, but I don't have a phone. So the health educators can help get them signed up and hooked into those programs as well. So they can either go in person or they can call on the phone.
Okay. Very cool, very cool. I believe that's all we have time for. So thank you so much for joining me today in this discussion of this very important topic. I think it's been a really great time, and I think we're going to have to take a small break before our next panel.
Thanks so much.